This video is associated with assessing a patient who has chronic obstructive pulmonary disease. COPD encompasses two diseases, which is emphysema and chronic bronchitis. Most clients who have emphysema also have chronic bronchitis, and COPD is irreversible. When beginning the assessment of a patient with COPD, you should take the health history, which includes if the family has a history of chronic lung disease, if the patient himself is a smoker, or if he is around secondhand smoke. You should assess the patient's occupational and environmental risk factors, what he works around, where he lives. Does he work or live around factories that let off a lot of chemicals in the air? You should palpate the PMI, auscultate the anterior and interiorly in all four lungs, listen for abnormal breathing sounds when breathing. You should assess the peripheral pulses, palpate the abdomen, light palpation, deep palpation. You need to inspect the contour, symmetry, skin characteristics. You should also ask the patient if he has experienced shortness of breath or wheezing, because those are also symptoms when assessing a patient with COPD. Expected findings with chronic dyspnea: the respiratory rate can reach 40 to 50 minutes during acute exaspiration. Physical assessment findings include dyspnea upon exertion, a productive cough that is most severe upon rising in the morning, hypoxemia, crackles and wheezes, rapid and shallow respirations, use of the accessory muscles, a barreled chest or increased chest diameter, which is related with emphysema. And a barreled chest is a very common side effect of a patient with COPD, so you really need to pay attention to the chest diameter of that patient. Hyperresonance on percussion due to the trapped air in the lungs, which is also related to emphysema. Irregular breathing patterns, thin extremities and enlarged neck muscles, dependent edema secondary to right-sided heart failure, pallor and cyanosis of nail beds and mucous membranes, which is the later stages of the disease. You should check for decreased oxygen saturation levels. The expected reference is 95 to 100%. Older adults or clients who have dark-colored skin, the oxygen saturation levels can be slightly lower. And you should also check for clubbing of the fingers and toes, which is also a sign of the later stages of COPD. It is very important to listen to all four lobes of the lungs, to listen for any abnormal breathing sounds like crackles, wheezing, or anything like that. And it is very important just to assess all of these parts, which includes, the abdomen, to check for any signs or symptoms of COPD.